What if I were to tell you, anytime soon, healthcare will change dramatically? By the year 2020, every newborn baby will have its DNA mapped. This will help doctors make more accurate decisions when treating disease anytime during a patient's life. Anytime soon, this new science will help your doctor to become more insightful, with the ability to prescribe more personalized and effective treatment options. Doctors will become more proactive and will even be able to prevent disease. Today, the way we address disease is mostly reactive. Often, we are able to start treating a patient only after symptoms show. Today, most medication works on average in only 1 out of 2 patients. And finding the right medicine for the right patient is still a trial and error approach. Today, healthcare costs around the world are spiraling out of control. And as countries develop, their populations also demand better care. But anytime soon, we will be able to predict a patient's response to a medication and foresee and prevent disease by treating it well before it is revealed. Anytime soon, a genetic blueprint will help offer customized care and make high-quality healthcare affordable. Anytime soon, with Genizon. Genizon Biosciences has developed a state-of-the-art genomic discovery platform to identify genes and metabolic pathways involved in diseases. This platform can also discover biomarkers for diagnostic tests to guide in selecting the right drug to treat a patient, or it can even help prevent a disease from developing at all. The efficient genotyping platform measures DNA variations with high accuracy and can produce as many as 7 billion genotype measurements per month. Genizon's proprietary genetic analysis pipeline is able to identify the loci on the genome that are associated with a disease and discover how these loci connect. Supporting the platform is a sophisticated, fully integrated IT system engineered to capture, store, analyze, manage, and exchange the massive amounts of data involved in genomic research. Today, Genizon's main genetic database contains more than 19 billion genotypes. The IT system has been designed to be scalable to accommodate the exponentially increasing amounts of data forecast for coming years. Anytime soon, whole genome sequencing will become the standard. Genizon's solution to the ever-increasing demand for computing power puts cluster and cloud computing to work to split complex calculations into many smaller packets that are processed separately, and then are recombined to create the final results. Genizon's unique and flexible approach seamlessly integrates private and public computing clusters and clouds to meet the computing power demand. Confidentiality and security is protected by innovative data compression and encryption technologies. Since 2005, more than 400 genome-wide association studies have been published. These studies led to the discovery of important genetic clues to help battle diseases. However, more than 90% of these studies have focused only on North Americans and Europeans. Near-future medicine will rely on diagnostic tests of DNA variations to determine the risk to an individual of developing a disease like diabetes, and to predict a patient's response to available treatments. All humans differ from each other genetically with less than 0.1% of their DNA sequence. Scientific research has revealed that DNA variations within that 0.1% even differ across populations. For example, the number of people suffering from type 2 diabetes in the Arab world is expected to increase from about 25 million today to around 45 million by 2025. Over time, this disease leads to many serious health complications for these patients and puts enormous pressure on the healthcare system. Scientific studies now have shown that DNA variations that are associated with type 2 diabetes in Europeans are not all found in Arabs. This means that Arab countries cannot rely on knowledge generated from studies on Europeans and Americans. They'll need a custom-tailored solution to get the diagnostic tests necessary to predict disease and drug response in their populations. Now is the time for countries whose populations are not well served by the current research to establish their own genomic research platform. Genizon, a pioneer in genomic research, now offers a turnkey solution to enable any country to have their own state-of-the-art biobank and genomic research program up and running within 1 year. This turnkey solution includes the setup of a laboratory and the IT infrastructure necessary to securely capture, store, and manage the data. Also included is Genizon's unique genetic data analysis pipeline, as well as training and day-to-day support. Once the facilities are up and running, Genizon will continue to provide scientific and IT support and consulting. And as new technologies such as whole genome sequencing mature, Genizon will help incorporate them into the existing workflow. Genizon has invested 10 years and over $100 million into developing their existing platform. We now offer this knowledge to you so that you can focus research on those diseases that are most important to your country and better serve the healthcare needs of your population. The platform will create new employment opportunities and encourages innovation, as well as the ability to locally commercialize the discoveries. Establishing this infrastructure now will create the foundation necessary to benefit from the new healthcare paradigm that is coming over the next decade. Anytime soon, with Genizon. Dassault Systems is a worldwide leader in product lifecycle management. Enovia V6 is the next-generation platform to harness the collective intelligence of an online community, merging the real and virtual in an immersive, lifelike experience. The Enovia collaborative platform delivers the flexibility, scalability, and industry-specific functionality to bring together multidisciplinary teams of contributors. It is ideally suited to form the foundation for the management of a country's integrated healthcare system. When linked together, the Enovia and Genizon platforms will become the basis for the research leading to a new personalized care-based healthcare system. Ultimately, it will allow entire communities of doctors, researchers, governments, and other specialists to seamlessly collaborate. It will offer them a unified view and secure access to all data and decision-making tools.